My research is about the influence of multiple genetic variants on smoking behavior and how this information can be used to personalize smoking cessation treatment. The most important conclusion of the research is that genetic information can be used to predict in advance which smoking cessation therapy will be best, and that smokers and health practitioners are interested in such a genetic test. We started with a literature review to select the genes and the genetic variants that are expected to influence smoking behavior. And after that, we collected DNA of smokers participating in several smoking and smoking cessation trials and genotyped these participants for this selected genetic variants. And we determined whether these genetic variants had an effect on the level of nicotine dependence and whether it influenced the smoking cessation success using antidepressant therapy. There are actually two groups of genes which are really important in smoking behavior. The first is a group of genes which influences the nicotine levels in the body, because nicotine is the most addictive substance in cigarettes. And secondly, there's a group of genes which are responsible for the effects of smoking in the brain. And that's the second set of genes which influences these processes. This field of research is still in its infancy, and therefore much research still needs to be done, both at the basic molecular level but also at a more translational or applied level. And furthermore, the research has the potential to help thousands of smokers and also improve the health of many non-smokers. In the future, this information will help us to develop a genetic test that can help us to determine at forehand which smoking cessation therapy will be most effective for individual smokers. And this will lead to increased smoking cessation rates, less side effects, and also less frustration for smokers and healthcare practitioners.